Welcome back to NewsNation Live. It's a race against time for drug makers as they compete to be the first to have an effective version of a weight loss pill. The New England Journal of Medicine recently published a study on Eli Lilly's drug, orforglipron. Now, the preliminary research suggests that the oral method rivals currently approved injectable therapies. The drug is being tested longer to assess its full efficacy, but unlike currently approved medicines for weight loss like Ozempic and Wegovy, orforglipron is a daily pill, not a once-weekly injection. On Sunday, pharmaceutical company Novo Nordisk also shared similar findings regarding their oral version of the medication. Joining me to talk more about this is Dr. Stephen Stites, Chief Medical Officer at the University of Kansas Health System. Dr. Stites, I have to jump right in there because you and I both know so many people are looking for that magic pill. What do you make of this possible version of these types of medications being in pill form and making it easier for people to maybe get the health effects that they're looking for?
This is really good news. We got a long ways to go from this news to actually having a pill that'll be able for somebody to take on a regular basis, but it's clearly a step forward. Obesity is one of the largest healthcare crises we face in America, so anything we can do to help with that is great, and I think an oral pill will be just one of the best tools we could have. You know, the injectables work great, right? And they were never intended for this purpose, but it turned out that they worked as they were also treating diabetes and has significant impact on weight loss. Having an oral pill that can even come close to that would be really a great step forward.
And again, we don't even know the long-term effects of the injectables just yet. And so that would also take time with the pill. But once the pill clears the necessary hurdles, which method do you think would be the most favorable amongst those who actually use the drug?
You know, that's a great question. A couple of quick thoughts. First, you're gonna have to weigh the side effects too, right? We don't know the side effects of the pill. We have a better understanding on the long-term impact of Ozempic, and we know that as long as you're using the injectables, you continue to keep the weight off. You could see lots of different strategies emerging. Let's say you achieve more significant weight loss with the injectables. You may start with that and then transition to a pill to try and keep it off. Or you may just decide, I don't want to do the injectables because I don't really like the idea of feeling like I have a bee sting every day, so I'll just take the pill. It's very simple. Others may say, man, just injecting it once a week, that's a pretty sweet deal. I don't have to think about taking a pill every day. So I think we'll just have to see how this information plays out. First, what's the most efficacious? Second, what's the role both short and long term? Third, what are the side effects that could be out there? And finally, fourth, what's the cost? And how much will I, as a consumer, having to pay for part of my health care, have to pay for to have these medications?
And if insurance will cover one of those and not the other, you better believe that people will be leaning on their insurance plan to try to cover cost of one of those drugs. Let me switch topics here for you, though. Another big health topic that we've been discussing here in the newsroom is that research has found that an alternative to statins could help reduce heart disease death among people with high levels of LDL or bad cholesterol. Now, the alternative is called bemodic acid. What is that? And when taken daily as a pill, how does it lower the bad cholesterol?
You know, what it does is it works in a similar fashion in some ways as far as cholesterol, because it's going to lower both cholesterol and LDL, which is really a great outcome. What we're hoping is bemodic acid may not have the same list of side effects that the statins do. The statins are the gold standard. They do a great job. Many people can't tolerate them. I tried like 10,000 different statins. I could never tolerate one of them. So trying to find one that people will tolerate without the side effects is really going to be a big deal. So I think bemodic acid may be a good step forward. Whether or not it has the same long-term impact will take years of study to do. I think that the drug is off to a good start, though. We'll see how that
You've talked about even your own level of discomfort, and you and I both know, we know people in our own lives who are hesitant to take the drug. What do you have to say to those who are on the fence about cholesterol-lowering medication in general?
Well, you know, there are some injectables that work really well in addition. They're more expensive. And again, you have to do an injection every 2 weeks or once a month. So the injectables can be pretty effective, but having another pill would be a great alternative. It's still a ways off. The other challenge you face in the meantime is work with your primary care doctor. If you don't tolerate statins, and there are a lot of reasons not to, if you don't tolerate them, then try some of the injectables perhaps, if that's what your primary care doctor or your heart doctor is recommending. And then if that doesn't sound right, then you could try some of these new pills as they come available.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.